Hi, I'm Dr. Stuart Menakar from the Palo Alto Medical Foundation, Los Gatos Center. I'm a family doctor here. Welcome to Health Connections on KCAT television, Los Gatos, Montessorino. On today's program, I'm here with my lovely colleague, Dr. Thaichan Jobalia, who's one of our geriatric specialists at the Palo Alto Medical Foundation. Welcome to the show, Thaichan.
Thank you for having me, Stuart.
Very happy to have you. So let's start, if we may, Thaichan, by just asking you to tell us a little bit about your background and then why you decided to become a geriatric specialist.
So, Stuart, I graduated from medical school at UCLA in 1995, and I went through the residency training program for internal medicine at Santa Clara Valley Medical Center and finished the program in 1999, and then decided that geriatrics is my passion. In general, I like all ages, but one patient in particular really inspired me during my training program to become a geriatrician.
Tell us about him or her, if you would, please.
He was a veteran of World War II and had a lot of wonderful stories to tell about his days in the service. And I found that the older patients are, the more stories I have to tell, and those are the most fun interactions I've had in my career.
In my own practice in family medicine, I see newborns and I see older folks. My oldest patient is about 101 right now. And I remember in my training, the oldest patient I took care of was a Spanish-American War veteran who was 113 when I was in medical school.
Wow.
You probably have patients like that too.
I sure do. I think my oldest patient that I've had thus far is 106.
Wow. It's amazing.
Yeah.
Well, Thaichan, I know that geriatrics is a specialty of helping all of us get to be 106 or 113. But how about if you explain to our viewers a little bit more about what geriatrics is?
So geriatrics is a discipline of medicine that takes care of health issues that affect all elderly patients. And a geriatrician is someone who is especially trained to evaluate, to manage all the health care issues that uniquely affect the elderly.
And do you only see the old elderly folks?
Actually, I used to. In my previous job before I was at Valley Medical Center, I did only see elderly patients. Since I joined Palo Alto Medical Foundation, many of my patients referred their grandchildren and their children, so I essentially take care of some younger patients as well.
Does every elderly person need to see a geriatrician?
That's a great question. Actually, in the United States, most older adults are taken care of by their primary care physician, and that can be their family practitioner or an internal medicine doctor. Generally, though, as a person gets older, maybe 75 years or older, and have developed more complex medical problems, they may need the intervention of a geriatrician because they've developed disability. Their medical problems are too complex, the medication regimen is too complex, making it difficult for them or their caregivers to navigate. So a geriatrician's intervention can sometimes be key to navigate the really murky water of multi-specialty, multiple medications.
Mm-hmm. At the Palo Alto Medical Foundation, in different parts of the clinic, there are all kinds of resources for elderly patients and their families, and lots of things in the community. On today's program, though, we're going to talk mostly about the sorts of medical problems that you and I see in our elderly patients in the office, and ask you to help our viewers, both the patients and families, to understand things to watch out for and how we handle those.
Sure.
Now, a lot of people may not think that falling is a medical problem. You know, for most of us, when we're younger, we fall down, we get up, we brush off our knees, and we go on our way. But you and I know, most doctors know, that falls, particularly in the elderly, is a very serious problem, or can be a very serious problem. So I'd like to start there. Talk about falls in the elderly, please.
You're absolutely right. Fall is not something I take lightly in my elderly patient. And a lot of my preventive care time is spent on preventing falls. So let's start with, say, the end result, and then we'll talk about what things we can do to prevent falls.
Perfect.
So unfortunately, with falls, it can lead to the serious problem of fractures. That's one of the dreaded consequences of falls. And then from fracture, it may lead to hospitalization. Complications from hospitalizations can include pneumonia, for example, pressure sores, and then the fall itself can lead to disability in the future. So we try as much as possible to prevent fall. And some of the ways I tell my patient to prevent fall is to stay active. So being active means actually participating in the work to keep their house clean, to garden, take a walk, but then also have an active exercise program. And I generally recommend 20 to 30 minutes of cardio exercise every day.
Thaichan, what do you mean when you say cardio exercise?
An exercise or cardio exercise program is where you have planned a particular regimen of activities that make you breathe a little harder, make your heart beat a little faster, and maybe perhaps make you sweat a little bit. That's what I mean by cardio exercise. So it could be a brisk walk for 20 minutes, riding a stationary bike for 20 minutes, or even swimming. That's considered cardio exercise. Now, there are actually balance classes. There has been well-done studies looking at Tai Chi as a special kind of balance training class that can help prevent fall because it improves core strength in the elderly patients.
Well, a lot of our patients do weightlifting when they're younger. Is there any value to lifting weights in our older patients?
Absolutely. That is definitely one of my recommendations besides participating in exercise programs to keep your muscle mass strong and to prevent muscle atrophy that naturally occur as one gets older. So weightlifting or weight training maintain muscle mass and keep your hamstrings, which are your thigh muscles, strong and fit, and that maintains core balance and prevents fall.
So I hear you saying that the old adage of use it or lose it is especially important when we're elderly so that we can maintain independence
Yes.
And strength.
Absolutely, absolutely.
And so when we talk about core strength, balance, not falling, what other advantages are there to our elderly patients in maintaining cardiovascular exercise and maybe some weight training?
Exercise is not only good for your body, it's good for the brain too. There has been a lot of different studies showing that the more active a senior is, the better his or her cognition. So we believe that cardiovascular fitness predicts brain fitness. What that means is the better your blood flow with exercise, the better your memory or cognitive function is over time. Muscle training does keep you fit, maintain balance, and prevent fall, but it also is good for bone health. As you could imagine, as a woman or a man gets older, they can develop osteoporosis or thinning of the bone. With bone strengthening exercise such as weightlifting, that does maintain bone health over time for older men and women to prevent osteoporosis.
And osteoporosis is thinning of the bones, which increases the risk of fractures. And if you fall and you have increased risk of fracture and so on, it's a vicious circle. So exercise, as I like to tell many of my patients, is the fountain of youth. But we're all going to get old, or we hope to. If we hope to get old, we need to exercise, and especially if we'd like to be healthy and have a healthy brain when we're elderly.
Absolutely.
So Thaichan, we've talked a little bit about falls, muscle strengthening, exercise, how it's good for your bones, good for your brain. But are there other things you'd like to tell our viewers about falls, exercise, strengthening, and prevention in the elderly?
In terms of keeping the environment safe, that is important to prevent falls. At my patients' annual wellness checkup, I do ask about what safety measures do you have at home to keep you safe. Things I ask are, do you have good lighting to go from your bedroom into the bathroom? Do you have loose rugs that are not tacked down? Do you have good shoes that you wear outside the house that will allow you to walk safely without tripping and falling? Those are some of the environmental issues that can keep you safe and prevent fall.
Mm-hmm. Well, as we talked about exercise and cardiovascular exercise, you mentioned that a good heart, a healthy heart, helps maintain a healthy brain. So many of our patients or their family members get concerned about memory issues,
Yes.
memory loss. Please help us understand a little bit about what do we consider some normal memory changes, and when do we need to be concerned about greater issues in our family members or in ourselves?
Well, as you could imagine, as a person gets older, his or her memory will decline. That is somewhat expected. And there's definitely normal age-related memory changes. The trick is to find out or diagnose when this memory changes are disease-related or can cause pathological diseases that requires treatment. In general, as an older adult gets older, they take longer to recall facts, to recall name, or recall places. But eventually, they get to where they need to be. Whereas an adult with cognitive function impairment that becomes a pathological, meaning it becomes a disease, they will start having impaired cognition affecting their day-to-day function. What I mean by that is a person who normally cooks great, elaborate meals can't pull together a simple pasta dish because he or she can't remember the ingredients for the meal. Or Mr. Smith can get paperwork together to go to the bank to deposit a check where his normal job is a CPA. So when your memory starts to affect your day-to-day function, that becomes an illness that requires evaluation, assessment, and perhaps treatment, as well as future planning for eventual further decline, if there is any.
So, Dr. Jobalia, in your geriatric practice and in my family practice, both of us see patients who come in are concerned that some of their memory changes might be early signs of dementia. I know there's some basic testing and things that we do to try to help decide if there's another cause of memory troubles besides dementia. Could you tell us a little bit about how we start to differentiate between underlying medical conditions that can lead to memory troubles versus it truly is dementia?
So in my evaluation, it's always the early stages of memory impairment are always tricky for us to evaluate and differentiate between a disease causing dementia versus just age-related changes. I also evaluate for what we call reversible causes of cognitive impairment. What I mean by that are things like thyroid function depletion or an underactive thyroid gland that can cause one to become slow and acting as if you have a cognitive function impairment. I also check for vitamin B12 deficiency, which can impair memory or cognitive function as well. And then in the evaluation, I will check for conditions like stroke, which can cause cognitive function impairment. But the tests that we have, all the questionnaires that we have, are all really crude tests. It's really much more important and much more telling to ask family or caregiver or observers of these patients in their home what they normally able to do and what they cannot do at the moment. And that really is very telling and telling us, is there any functionality impairment? Which means then the cognitive function impairment is now a dementia illness.
So you're saying that your focus in that evaluation is a lot on function and the ability for someone to carry out their normal activities once you've made sure that certain issues like thyroid or depression or stroke aren't causing the change in the person's thinking.
That's right. That's right.
So then is function one of the main goals, or helping to preserve function one of the main goals in helping folks with early dementia live their lives?
I think maintain function and functional independence is like the primary tenet of geriatrics. We do everything we can to try and maintain patients' functional independence for as long as we can, whether it's from dementia or arthritis or diabetes or anything else. The whole goal of being a geriatrician is doing everything you can to try and maintain independence or functional independence. And so, yes, even beyond just prescribing medication, I do discuss with patients and family as well as caregiver the various techniques or exercise, even we're going back to exercise, in keeping these patients independent or functionally independent for as long as possible is to keep them moving, to keep them engaged. So even in patients with dementia, I will advocate for keeping them connected to a community, family, caregiver, friend network, so as to keep these patients cognitively and socially engaged, with the goal is to keep them in the community for as long as possible.
I think they probably all appreciate that very much. Are there also medicines that you might use to help people with dementia?
We have a variety of different medications to help slow down the progression of memory loss. There are no medications that have been proven to reverse the process or even halt the process. The best the medications can hope for is to slow down the progression of further memory loss. But really the point of early diagnosis is so that you can plan for the future. So advocating for maintaining independence with exercise, doing estate planning, doing a care planning for in the future, should this person further cognitive decline, further functional decline, where will they be? So care in the future and advanced planning is important in the early stages of cognitive function impairment.
So if I'm hearing correctly, I think you're saying that the medicines we have help some with symptoms, but they don't really slow or halt the progression of dementia. So we use them to help out, but no cures yet for dementia.
That's correct. It is an active area of research, though. So very exciting things are done by various drug companies, including vaccines, antibody testing. But as of now, there is no cure, unfortunately.
We've talked some about medicine specifically for dementia, but as a family doctor, I know that there are many medicines we use without thinking too much about the impact on the rest of the body in younger people. But in older folks, we commonly have to think twice before using them or adjust the way we use them. Can you explain a little bit about why that might be?
Older adults suffer from multiple different medical problems similar to what younger cohorts have. However, their response to medications can be very different. And medications that are perfectly fine given to a younger adult, such as, for example, Benadryl to use as a decongestant, to use as a sleep aid, can cause an older adult who may have mild memory impairment have delirium, which is a condition where these patients become acutely confused. And so you would think Benadryl, such a benign medication, it's over the counter, readily available, can be taken with impunity. But in fact, medicines like that can cause this confusional state. So the reaction of older adults to all sorts of medication is very different than their younger counterpart. So I am, as a geriatrician, very aware of what medications I can prescribe and which one I should avoid. In fact, I am also having to be aware of dosage. Medications that are perfectly acceptable to prescribe for younger patients for blood pressure management, for example, at a certain dose, I may have to reduce by 50%, by 75% at the start. So the adage in geriatrics is start low and go slow, and I really believe in that.
Makes good sense.
Yes.
And I really appreciate that you use Benadryl as an example, because I think it's very important for our older patients and for our family members who are caregivers of them to remember that over-the-counter medicines are still medicines.
That's right.
So it's always wise to check with your primary care doctor, your geriatrician, about whether or not it's safe to be using your medicine or an over-the-counter medicine.
That's right. I agree.
So besides the way our bodies respond to medications, I know that elderly folks commonly don't respond to infections or show the same symptoms of infections that younger folks do. How about if you tell us a little bit about that, please?
older adults and the way, not only how they respond to infection, but how they present with an infection is very different. And what I mean by that is, let me give you an example. With urinary tract infection, younger patients or a younger woman may come in with your typical painful urination or fever or abdominal discomfort. Well, my older women who have urinary tract infection may not come in with obvious symptoms like that. They may come in because their daughter has noticed that mom is more confused or mom is extremely weak. She's not able to get out of bed to get herself dressed, or that she has lost her energy. She is all of a sudden taken to bed and doesn't get out of bed. And so when an older adult come in with vague symptoms like that, we often have to go hunting, if you will, for various causes. And we have some typical usual suspects of infection. Pneumonia being one, or bladder infection is the other common source of infection in the older adult who don't present typically. And I have to ask questions, gather data, chest x-ray perhaps, a urinary analysis at the lab, or blood draw before we're able to determine what might have been the source of this change in personality in the patient.
So sometimes a change in thinking, we've just talked about dementia, but sometimes a change in thinking is a sign of a medication issue or possibly hidden infection.
That's right, that's right.
So this is actually very apropos for me. I just had a gentleman in my office yesterday who was recently traveling, and he said when he got on his airplane, he felt a little tired and weak when he arrived, but didn't think too much about it because he had just been on an airplane. And he went to visit his family, and a few hours later, someone in the family found him sitting on the toilet slumped over. And they rushed him to the hospital, and it turned out he had a life-threatening infection in his blood. He never had a fever, he never had troubles with urination, never had a cough, but here this man ended up in the ICU with IV antibiotics just because he felt a little tired.
That was a very astute family to have brought him in quickly. But yes, serious infection can take off in an older adult very quickly, often without warning, exactly as you have stated in your patient.
Yeah. So any change in the thinking processes of an elderly person that occurs rapidly is a reason to get in and see the doctor.
Absolutely.
You know, one other thing while we're talking about infections that we haven't talked about is fever. Tell me about fever in old people.
Actually, I have hardly seen fever in older adults when they're sick. And when I actually see a real good old fever of 101.5 degrees Fahrenheit, I get very, very alarmed. So most older adults hardly get a temperature. Maybe 99 degrees degrees Fahrenheit is a fever. But for the most part, I can't use fever as my pulse, if you will, or the hallmark of an infection. Not having a fever doesn't mean one doesn't have pneumonia, or for that matter, even sepsis, which is an infection in the blood, for example. So it is not always an important sign, but when I see it, I get very alarmed.
Again, an important thing for our older folks and their caregivers to remember. Let's talk briefly again. I don't want to harp on the idea that things don't always show up the same way in elderly folks, but 1 in 3 people in the United States dies from cardiovascular disease. But again, not always the same presentation in the elderly. So how might we see an elderly person present if they're having a heart attack?
Cardiovascular or heart disease in older adults may still present with chest pain, typically described as pressure on the chest. But you're right, just like other infection that doesn't present the same way in the elderly, cardiovascular disease or heart attack, for example, may present very differently. Typically, you will hear stories of, I normally can walk 2 miles and now I hardly walk a quarter mile and I'm getting short of breath. So a decline in function, a decline in the ability to exercise, or shortness of breath may be very telltale sign of heart disease. And I have recommended to my patients to keep an eye out for these things if they have already known having underlying heart disease.
What happens to elderly folks and their kidney function?
There is a natural decline in kidney function in the elderly. Just by having too many birthdays, and you will have a decline in your kidney function. Because these cells in the kidneys are extremely fragile, these filtering cells, they do atrophy over time as one gets older. Therefore, all doctors, geriatricians especially, are very alert to the fact of the natural decline in kidney function in the elderly and have to prescribe medication accordingly. So that's the reason also why we do start low and go slow, is because we don't know how our older patients take to certain medication.
Are there things that our elderly patients can do to help reduce the risk of troubles for their kidneys or to slow down damage to the kidneys?
Yes, there are certainly many things our older patients can do to prevent as well as slow down further kidney function loss. The number one thing being avoiding any medications that can cause kidney function damage. Again, going back to the over-the-counter medication. So medicines like Advil or Motrin or Aleve, and even nowadays we're hearing about Prilosec. All of those taken over a long period of time can cause kidney function damage. And so if our patients take them for any length of time, more than a few days is my good rule of thumb, they ought to advise their primary care physician about these medications. But another important thing to keep your kidneys function healthy is to drink and stay hydrated. As a nephrologist has once told me, water them beans. You got to keep them well hydrated. So stay hydrated is really important to keep your kidneys happy.
So watering those beans, those kidney beans, is an important thing for good kidney health. Also, taking care of high blood pressure, right? So when we have patients our age, and maybe even younger, since I'm a little older, we want to make sure that protecting your kidneys with good blood pressure control in your younger years can help your kidneys last a longer time in your elderly years.
Absolutely. So the common illnesses of high blood pressure and diabetes certainly can damage your kidneys. So if you do a good job with maintaining your blood pressure, taking your blood pressure medications as prescribed, as well as controlling your diabetes if you have diabetes, those are the things you can do to protect kidney function for future use.
So Thaichan, we've talked about memory, we've talked about the importance of exercise, protecting your kidney, how elderly patients may present differently when they have troubles. But let's talk a little bit more about things elderly folks can do to stay healthy. Do our elderly patients have special needs in terms of their diet or vitamins or anything of that sort?
So nutrition in the older adults is quite important in terms of supplementations. I'm not a big vitamin pusher, if you will. However, I do tend to ask my patients if they have a relatively healthy diet, if they've got a very colorful diet from fruits and vegetables, then I don't think that a multivitamin or general vitamin supplementation is needed. However, for bone health, I do recommend calcium as well as vitamin D supplementation in my older adult patients. General nutrition is important, meaning eating a healthy, balanced diet of carbohydrates, which are grains. Having adequate protein in their diet is very important. As we had discussed, older adults lose muscle mass. So protein intake in their diet is quite important. And as an older adult age, they may have a decline in appetite. They may eat less. Perhaps that has to do with decreased function, but in general, with decreased caloric intake, which may lead to weight loss, and then subsequently it may lead to muscle function decline. I do encourage patients to pay close attention to how much calorie they take in, and also special attention to protein intake as they age.
So if one of our older patients is losing weight for a reason we don't really know, they're not actively trying to lose weight, Sounds like that's another reason to check in with their doctor, with their geriatrician.
Absolutely.
So another thing that we do to help our elderly patients stay healthy is vaccinations. So we give lots of vaccines to little babies, but also to older folks.
Yes.
Tell us about that, please.
So just like little babies, adults also need to have their adult vaccines kept up to date. And I generally have a discussion with my older patients at their annual wellness check-in and make sure that all the vaccines are up to date. So some of the vaccines that are still important to maintain as you get older can include the yearly flu vaccine, which I feel is very important. And then every 10 years, tetanus and perhaps a whooping cough immunization might need to be kept up to date. Pneumonia vaccination is important. Even in this day and age of antibiotic, people still die from pneumonia. And one in particular by pneumonia caused by a bacteria called pneumococcal bacteria. And so I do encourage my older patients to keep up to date with these vaccines.
Thaichan, we've talked about all kinds of things about helping folks keep healthy, changes in their life, but all of us are eventually going to pass away. I know that an important part of being a geriatrician is being able to talk to patients about end-of-life planning. So what do you say to your patients?
I actually talk about end-of-life planning usually by the first time I meet with a patient. And I will preface it by saying that we need to plan for it now while you're healthy, while your brain is functioning perfectly, so that you can designate a person to speak for you if you can't speak for yourself, should you become too ill or too sick to make medical decision. So advanced planning includes picking your power of attorney for healthcare, and then it also gets you thinking about the various technology we have in medicine that may or may not be right for you. What I mean by that can include CPR, can include ventilator, which are machines to breathe for you if you cannot breathe for yourself. It can also mean kidney dialysis. It could also mean tube feeding if you cannot take in enough calorie by mouth. And so this kind of conversation should be had pretty early in a relationship between the older adult and their doctor, so that the doctor or the medical community know exactly what the patient wants. And the time to do it is when they are perfectly healthy.
Well, I couldn't agree more with what Dr. Jobalia has just said about end-of-life planning, advanced healthcare directives, and creating powers of attorney. One thing that's wonderful for us at the Palo Alto Medical Foundation is there are a lot of resources available for us and our patients, some of which can be found online, including the standard state of California forms for advanced healthcare directives.
Yes.
Also online, our older patients and families who help care of them can find great information and links to community resources, classes, and other information specific to the geriatric patients. So I'd like to thank Dr. Jobalia for joining me today on Health Connections. It's been a pleasure. Thanks very much. It's good to see you again.
Thank you for having me.
So it's wonderful to work with Dr. Jobalia and all of our specialists here at the Palo Alto Medical Foundation. I hope today's segment has given you a little bit of an idea of things to watch out for if you're elderly and are concerned about maintaining your health. And also for those of you who are caregivers of elderly people, I hope that you have some new information you've learned today as well. So I'm Dr. Stuart Menakar, a family doctor here at the Palo Alto Medical Foundation. Thanks for joining me on Health Connections, KCAT Television, Los Gatos, Monte Sereno.